An interesting approach and drug called GRN1005. This is a drug that is designed to penetrate the blood-brain barrier and is being tested in patients with brain metastases. The lipoprotein-related receptor peptide, which allows it to cross the blood-brain barrier, is bound to paclitaxel. This drug is now in phase 2 testing, and the question here is whether, number one, we can see responses in CNS disease in patients who either have progressed after radiation or even in patients who have not received radiation. So both cohorts are being tested. And also whether we might see responses in systemic disease. This trial is enrolling patients either with other extra CNS metastases or patients without them. Patients need to be clinically stable in terms of their brain and systemic metastases, and the endpoints include both responses in the brain, the primary endpoint, but also systemic responses, since this drug does also reach other tissues. This drug does have some of the same expected toxicities of paclitaxel, such as cytopenias and neuropathy, yet its penetration of the blood-brain barrier could be significant enough that it can treat diseases of both sites, or may be used in patients that do not have options for local therapy. So we await the results of this trial as well.